Hello and welcome to the Joint Commission Resources Quality and Safety Network Accreditation Update. I'm your host, Gail Garbarino. To reduce the risk of wrong site, wrong procedure, and wrong patient surgery, all potential errors must be identified, starting from scheduling all the way to the operating room. The Targeted Solutions Tool, or TST, is an online application that allows healthcare organizations to keep patients safe from preventable harm across the whole continuum of surgical care. Let's take a look.
Wrong site surgery is a rare event. However, some estimates put the national rate as high as 40 per week. The costs are many, including the loss of public trust and the threat of malpractice suits that can result in multi-million-dollar judgments. This doesn't have to happen to your organization. If you're looking for a proactive way to recognize risk points, it's as close as your computer screen.
Wrong site surgery is something you never want to have happen. You don't want to have the event occur and then figure out what you can do to keep it from happening. You'd rather do something more while you can and never have it happen.
The Joint Commission Center for Transforming Healthcare has developed the Safe Surgery Targeted Solutions Tool, or TST, to help organizations identify, measure, and reduce risks in key processes that can contribute to a wrong site surgery.
So it was very easy. It didn't take too much on our part. It was already there for us. We just had to follow it through.
The tool walks you through your entire surgical process, focusing on the areas of scheduling, pre-op, and the operating room, and allows you the flexibility of working on all three areas at once, or addressing one area at a time. This web-based tool is free to all Joint Commission accredited organizations through the Joint Commission Connect extranet. The Safe Surgery TST is a step-by-step guide that is rich in resources that have been field tested by healthcare professionals just like you. Hospitals and ambulatory surgery centers that participated in the Safe Surgery project identified and measured their risks and implemented solutions targeted to those risks. Here's what they found. In the scheduling area, cases with risks were reduced by 46%. Pre-op cases with risks decreased by 63%. In the OR, cases with risks went down by 51%. This type of success is available to you by using the Safe Surgery TST.
After having implemented the tool, we've gain the acceptance and the buy-in from the surgeons, the staff, and the anesthesiologist to increase that percentage and get close to 100% compliance in the operating room and to drastically improve the compliance in the holding room.
Among the resources provided in the TST are training modules, which include videos showing examples of both good and bad practices. There are also interactive training materials that assess staff learning. A big plus is the TST's ability to provide advanced data analysis and automatically generate charts and graphs that represent your organization's performance. This allows you to easily share your data and performance charts with leadership and staff.
We learned there's always room for improvement. What we think in leadership is working effectively may not always be working the way we think it's working until you actually have some data that is measurable and you can print out and actually review with staff.
The TST-generated charts will tell you the rate of defective cases per day. The TST also shows the percent of those cases that contain more than one defect, and it provides a breakdown of results by specialty or surgeon. This valuable custom data analysis can lead your team to the top 3 or 4 solutions targeted to your key risk areas. Why spend time implementing solutions that may not, and probably don't, address your risk areas? The TST targets only those areas that need improvement.
The biggest improvement we've seen is that we've gotten a buy-in from the staff and surgeons at the beginning of cases. Previous to using the tool, we would have people working in the Mayo stand, checking gauges, writing things down, and not really paying attention to the timeouts. Now, however, everybody does stop. Everyone listens, and everyone agrees.
To help you successfully implement the targeted solutions, the TST also provides detailed implementation guides and checklists. The TST provides training tools and resources to prepare select staff members to collect observation data. Observations can be collected on paper forms or input directly into the TST using a tablet device, such as an iPad. Data collection is critical to the project since your focus of improvement stems from the data. And you can be assured that any data entered into the TST is kept confidential. You can begin to see improvements in as little as 8 weeks, with most organizations completing the project in 14 to 16 weeks.
By utilizing the TST, it allowed our employees to become empowered. It gave them a chance to stand up to the surgeon and actually stop them in a situation that may not be following policies.
To get started today, visit the TST webpage on the center website and click on the Request Access option to obtain your login information if you do not already have a username and password. For more information, call 630-792-5800 or send an email to tst_support@cth.org.
Now stay tuned for today's JCR QSN program.